The National Association of Free Clinics has brought this event to Kansas City to show the nation that the problem of the uninsured is a national problem. It's not something limited to the coast, but that it really is across our nation. And we feel strongly that we are in cities where we can provide care afterwards, so that we're not just there for one day, but we're hooking our patients into a medical home. And this is really because communities are responding every day, and that's what the Care Clinic stands for, to show that right now throughout the country there are many, many people taking care of the 45 million uninsured people that we have in our country.
Today we're down at Bartle Hall here in Kansas City, and we are having an uninsured event. So we're taking care of people who come from all of the surrounding area metro who don't have health insurance. When diseases like high blood pressure and diabetes are ignored for a long time, the consequences of those could be very serious. So our intent is to be able to identify people and get them treated so they don't have complications.
The importance of this event is that we will be able to channel the patients to the proper clinics, so that whatever issues they have will be taken care of.
This is a great opportunity for us to be able to both serve the community and demonstrate the need in the community. It's extraordinary how many people in our area with so many resources don't have access to care and don't have the ability to get care on their own. I'm looking around, there are many, many people here of all ages, not just elderly, not just young people, but of all ages that really need the service.
619-619. The company that I work for is a small business, and about a year ago, business was bad enough that they had to discontinue health care. So I've been without insurance for the past year, and this was a good chance to come out and get a checkup. The saddest part is that most people think, oh, you need health care for the inner city and that's it. But I'm seeing people, and I've talked to people here who are from all over the metropolitan area. Many of them are like me. They're working. They've got jobs. Some of them have good jobs, but having good jobs doesn't mean that you necessarily are going to get good insurance.
What they're doing today is very awesome. You know, that's really the only word to describe it, because the people, you know, they're lending a helping hand. They're here on their own free will. I've been asking, nobody's getting paid for the situation, you know, so it's like, the fact that they're helping so much is just a help for Kansas City.
There are people that have 3 part-time jobs that don't have health insurance, but yet they're diabetic, they have asthma, they have hypertension, they need care, and otherwise their quality of health, their quality of life is just not good. But because they come to us for care, it's a good feeling.
So many different people down here from different parts of the city. And I mean different parts of the city. They're from all over. You know, Kansas City, Kansas, Kansas City, Missouri, it doesn't matter. It didn't help the whole city.
Possibly the nicest part about it was that every time I sat in a waiting area, waiting for the next stage, there were 2 or 3 volunteers that were sitting around just talking to people, helping people relax, making people laugh. By the end of it, I don't think anyone was embarrassed that, oh, I'm at a free healthcare clinic. And that was a really nice thing to see.
It's fantastic to have this in Kansas City. The number of volunteers and medical professionals who came out just are testimony to what a great place Kansas City is. The number of free clinics and federally qualified health centers and hospitals and all other kinds of providers who came out to bring services today is fantastic.
2016, 2016.
The National Association of Free Clinics is pleased to have been a part of this clinic here in Kansas City, where the Kansas City community really responded and came together in the middle of a week to make sure that over 2,200 people got the care that they needed and that they got linked to providers in the community. We sponsored additional clinics the next week throughout the community with volunteers to make sure that those that got turned away really would get the care that they had come for that day. So this is another example of how caring our Kansas City community is, but we've also seen this at other cities that we've been in sponsoring these care clinics. So we are pleased to be part of it and to be a partner with the community.